Good morning. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, October 27, and thank you so much for joining us. This is your opportunity to get your questions answered directly. You can put them right into the box on Facebook. You can tag them on Facebook or Twitter with the hashtag AskDrArwady. You see, I'm sitting by myself here today, so there's no one to check social distancing with, but that'll just give us more opportunity to answer your own questions directly. You also see I'm sitting without a mask. That's again because I'm by myself. I am being extra careful right now, as I hope all of you are, to be wearing your mask and to be social distancing, no matter what. COVID is on the rise. I know you've all been following this closely over the next week, and we'll dive right into the data in a second and then get your questions. So, as a reminder, you can go to chicago.gov/coronavirus for everything related to the latest in COVID. And right up at the top is the link to our latest data. You can also get there directly by going to chi.gov/COVID-. Let's go ahead and pull up the dashboard and we will take a look. All right, so if we got the dashboard up. So first on the landing page, first and foremost, let's start at the bottom here with our daily cases. We're up to 94,344 cases and a rolling average of 797 cases per day. That 800 number is almost twice where we'd like to be, if you recall, which is staying below 400. And it's 4 times where we'd really like to be, which is back below the 200. It has been a remarkable rate of increase, unfortunately, over these last 2.5 weeks. We have a press conference at 1 o'clock this afternoon. If you want to tune back in, we'll be giving some more statistics, providing some more details. But our epidemiologist did some math, and 1 in 250 Chicagoans has been diagnosed with COVID just in the last 2.5 weeks, and those are just the people who have been diagnosed. Where we know probably 5 to 7 times that number of people have had COVID, that lets us know probably 1 in 50,000 Chicagoans has, I'm sorry, 1 in 50 Chicagoans has likely been diagnosed excuse me, 1 in 250 has been diagnosed, 1 in 50 has been infected with COVID, including those who are probably not diagnosed. Our testing numbers here at 12,371 on average do continue to break records every day. This is the most testing that we've done as a 7-day rolling average. You can see it's up about 13% from last week, but the cases are up 40%. And then finally, the positivity rate. You can see on here it's up to 7.4%, but in fact, we know as data is coming to us from the state, there can be some delay on that, and on the state side, it is marking out at about 7.7% today. There's some differences in terms of whether we're counting cases on the day that they're diagnosed versus the day that the test result comes in. Also some differences in the way that we deduplicate the data, but the bottom line is this is not good. We're very close to that 8% mark and increasing fast. You can see just a week ago we were at 5.8%. A week before that we were under 5%. Let's also just look very quickly at some of the demographic data here. I'm going to blow up the age here because I want you to see. We will just go for the last kind of month or two, and I'm going to blow this up. So this is, again, the different age groups. Red is our 18 to 29-year-olds, blue is our 30 to 39-year-olds, yellow is our 40 to 49-year-olds. And look at what is happening. Our 20 to 29-year-olds, 30 to 39-year-olds, and 40 to 49-year-olds are all having now the same rate of cases, and it's very high and going up. So I'm still hearing a lot of people saying this is just a problem of young people. No. And if you look, every single age group is going up here. Even in the gray and the pink at the bottom, those are our plus 70s and plus 80-year-olds. Those rates have also doubled over the last couple of weeks. The blue is our children, every single age group going up. Really a generalized outbreak. Seeing this across the city, seeing this across all race ethnicity groups. So I encourage you, if you're interested, tune tune back in at 1 o'clock. We'll be talking in some more detail about the data, but obviously, we needed to roll back on some of the indoor bars. We put the curfew for non-essential businesses in place, cut back on alcohol sales, and I expect with the way that things are going that it's likely that the state will actually impose some of the additional regional restrictions, which would include, as we saw for Suburban Cook announced yesterday, a closing of indoor restaurants. I'm very concerned about this, the economic impact, et cetera. I'm also very concerned about the way that this outbreak is going. The growth is the same as what we were seeing back in the first phase and the worst of our outbreak. So let's get right into some questions. I'm sure people have a lot, so go ahead and put them in the box. All right, so off Twitter, P33K at 20-somethinger from Twitter. Why do we count gunshot suicides as a COVID death? We don't count gunshot suicides as a COVID death. Let's talk again for a minute about how COVID deaths are counted. When someone dies here in Chicago, there's a doctor who needs to sign off on their cause of death. If they die in a hospital setting, that will be the doctor who was taking care of them or on the team at the time that they died. If it's not in a hospital setting, the medical examiner will make that final distinction. If somebody dies from a gunshot suicide or a car crash or any of the many other things that people die from, it is not counted as a COVID death. I know there's a lot of misinformation out there. I also see a variation on questions like this about aren't doctors just inflating COVID deaths and putting in that people are dying from COVID because they get paid more. Doctors do not get paid more when they put in different things that people die from. These are true increases in deaths. And maybe actually to this point, one of the ways that we look at the impact of COVID is not just the number of COVID deaths, but what has the number of excess deaths been throughout this pandemic. And so there is, I've got a couple of studies here. Here's one from JAMA, the Journal of the American Medical Association, from October 12th. The main author is Wolf, W-O-O-L-F, if you want to Google it. It's called Excess Deaths from COVID-19 and Other Causes, March to July 2020. So this is a look across the whole U.S. between March 1st and October 1st. How many deaths would have been expected versus how many deaths actually occurred. And in fact, there were 1,336,000 plus deaths. That is a 20% increase over the expected deaths based on what we would expect people, given all the normal things that people die from. And we know that 67% of those deaths have been attributed to COVID-19. We also know that some of the other areas that have seen similar increases in deaths are likely secondary impacts of COVID. For example, we've seen a significant increase as well in the percentage of change in deaths due to heart disease over that time period, where you think about people perhaps afraid to seek medical care because of COVID, delaying going in after a heart attack, or perhaps not having their access to medications that help keep their heart healthy. We also saw an increase in deaths from Alzheimer's disease and dementia. You think about people who may be in nursing home type settings where a lot of that has been disturbed because of the COVID deaths. So I really want folks to hear, this is data from 48 states and the District of Columbia. Connecticut and North Carolina were the only two excluded because of some data issues. But broadly, we've seen a significant increase, 20% in increased deaths from all types, about 2/3 of those due to COVID. Illinois is one of the 10 states with the largest number of excess deaths between March and July. So if you're hearing questions like this and thinking that people are making up deaths, I hope data like this will help unfortunately make the point that COVID is very real. It has killed a lot of people, and unfortunately it continues to kill people. Here in Chicago, average of 3 people dying every day, and Illinois, as you've probably seen across the state, has started again to be seeing major increases in terms of deaths. All right, K Sipich 70 on Twitter. I tested positive for antibodies through a study at work 2 months ago, but my wife tested negative. Is it possible that she didn't get infected even though we live in close quarters? Okay, really good question. So this is someone, just to put some context around it, who had the antibody test. Reminder, the antibody test is the blood test that is not looking for, are you sick with COVID right now, but it looks for signs that you've had COVID in the past and built up some immune response to it, some antibodies to it. And antibody testing has gotten a lot better over the course of this outbreak. You may remember early on in probably April and May, we were really worried. There were a lot of sort of unproven antibody tests, and we were seeing a lot of false positives and negatives. At this point, the antibody testing is really quite good. So I would not expect that this is a false test in any way, but I like this question because it is absolutely possible that your wife did not get infected even though you live in close quarters. I think we have a study that talks about that too, yes. So first, I want to be clear that we've done the reason we were able to flatten the curve here in Chicago is that we've gotten the average number of people down that someone with COVID spreads to. And where we worry, this is this R, this reproductive number. When that number is over 1, that's when we have an increase in infection. So it's over 1 right now, but it's not, it's like 1.1, 1.2. It's not even 2, meaning on average, one person with COVID is actually only spreading to one other person. And so in many cases, we actually don't see spread. The highest risk is in the household. To be clear, this is where people are interacting, often without masks, often without the social distancing. You know, these are the people who we love and who we're close to. So it is the highest risk of transmission, but it is not a given that in your household you will definitely transmit COVID. And this is why we make the recommendation so strongly that when someone has been diagnosed with COVID, or if they've had an exposure and they're waiting for a COVID test, we want them to isolate if they've been confirmed, or quarantine if they've been exposed within the household. And that means as much as possible for that 2-week period, try to be wearing the mask if you can, even within the household. Try to be sleeping in a different room. If you have different bathrooms, try to have the person who's infected use that different bathroom. Try to keep the food preparation separate. It's not perfect, but it absolutely makes a difference. And I've got a study here on this too. So this is from Clinical Infectious Diseases, October 12th. The lead author is Fung, F-U-N-G, so you can Google it. It's called The Household Secondary Attack Rate of SARS-CoV-2. And so in this case, they looked at actually 22 different studies from 10 countries of 20,000 household contacts. A number of studies have been done. What is the risk in terms of sort of actually spreading within the household? And they found that on average, 17% of the time was there spread within the household, but it ranged from about 4% to about 36%. So it really depends a lot on what kind of practices were people able to do. Where people are living in more crowded housing, of course, it's harder to keep that distance. They also found, though, that when people were getting tested more frequently, you did find more secondary cases. And so if only one test was done in follow-up for people in the household, about 9% of the time they found spread. Whereas if they were testing twice, it was 2 tests or more, it was more than twice that. So my takeaway for you on this is that yes, household spread is the highest risk factor. And if you recall, one of the messages we started pushing pretty hard last week because of this enormous spike of COVID we're seeing right now is that right now, you really should not be having anybody over into your household that does not live there, unless it is absolutely essential. So that would mean, if you have someone coming in for home health or essential childcare or essential education type purposes, that could be an exception. But where someone is coming in who doesn't live there for those essential reasons even, masking please, social distancing please. We want to do everything we can to stop COVID from coming into our homes, because that's where we let our guard down and that's where we see spread. All right. Angeline Vanderbilt on Facebook is asking, what is the turnaround time on a COVID-19 test? So we've been following this really closely all along. There's not one answer to that because it depends a little bit what kind of test you're getting, what kind of setting that it is. We are now starting to see some more of these rapid COVID tests where you can get a turnaround time within 15 minutes, but these are new. So just this week, for the very first time, literally yesterday, the health department received for the first time some of these rapid antigen tests, which again, just for some context, these are not the traditional PCR tests that we've been doing for months and months. These are a newer type of test, more similar to a pregnancy test or a rapid flu test that can be done on the spot without needing to send to a lab. It's a big step forward. They're not quite as accurate, meaning as sensitive and specific as the ones we've been doing for months. The ones we've been doing for months, sensitivity and specificity are in the high 90%, 97% in that range. They're very good. These are more like in the low 90% range. So there's more possibility for false positives and negatives, but if you're using them broadly and the ability to have a quick turnaround time, particularly where you're seeing a lot of COVID in the area, if you're positive on one of these rapid tests, chances are very good that it is a true positive. So where we look across all of our data, right now the turnaround time in Chicago roughly is right around 2 days, which is pretty good. In some of the larger hospital settings, they're able to do it even faster than that. In a few of the outpatient send-out settings, it's a little longer. But by and large, we've been at about a 2-day turnaround. Now, my concern, though, is that with all of the cases right now that are spiking, so many more people are getting infected, so many more people are getting exposed, and so many more people are worried that we're seeing a lot more people seeking testing. So for example, if you are trying to get tested at a City of Chicago site, please go online first. We've got availability at the mobile sites, but our static sites, Saucedo and Prieto schools, are full. They are totally booked up because even though we're doing 1,000+ people a day, so many people are looking for testing. So we've worked to make sure that we can maintain a good turnaround time, but the capacity limits are a big deal when we're surging like this. So the other message that I want to give loud and clear is that your first stop for a COVID test should be your doctor. That is where we most want you getting testing because that's where you're getting connected to the care that you'll need and the follow-up if you're positive. Those rapid tests that the health department got yesterday, do you know where we're distributing those? Directly into the federally qualified health centers because we want to make sure that they have the ability within the clinical setting to be doing those rapid tests and then doing follow-up with the PCR if that's needed. So just as it's going to be harder than it has been, and I expect that to continue to be able to get the very quick, easy access to testing. So your first step, please, to your doctor. If you don't have a doctor, the federally qualified health centers, the health department is working really hard to increase capacity. We're already funding the great majority of, or the largest percentage of tests that are being done in the hardest hit areas of the city. But please go online and make an appointment as much as you're able to, no matter where you're trying to get COVID testing done. Aubrey Germain Ness on Facebook is asking, are we testing the wastewater for COVID RNA to predict a spike in cases? So this is one of the areas, if you were on with us, I think the week before last, with the Walder Institute, the Walder Foundation, excuse me, they were talking about some of the research work that's being funded, and some wastewater type research work is among the work that's being funded with universities. So this is starting to happen at a small scale, but it's not something that at this point is being used as it is in some rural areas, for example, to detect cases for the first time. When numbers are this high, we don't need the wastewater, unfortunately, to let us know that there's a problem. What we've learned sort of across the country where this has been done is it's particularly useful for detecting in settings that have not seen COVID, are you is it in fact there? So it's been useful. You know, I was on this interesting call with folks in Alaska, right, where you've got a very rural area that tends to be quite disconnected. If you're starting to see COVID in the wastewater there, it lets you know COVID has arrived. It's also, in my opinion, been used in interesting ways to test out of a given building. So out of, like, on a university campus, for example, if you're able to sort of see a given building is seeing cases, you can go and do testing in that building. It's been used in some correctional settings in an interesting way. So it's still in its sort of relative infancy, I would say. CDC is funding a lot of work in this space, so we understand how this kind of surveillance can be most useful. So there is early work for this happening in Chicago, and we will share with you when the researchers have more to share about that. Kimberly Brisky on Facebook is wondering, can flu and cold viruses be spread by pre or asymptomatic people, as is believed to happen with COVID? So by and large, not really. This is one of the things that's made COVID so difficult, is that in the 2 days prior to symptom onset, it's actually when people have some of the highest levels of virus in their nose and in their mouth, and they're most able to spread disease. That is not the pattern that we see for most viruses. Typically, people are not infectious until they start to show symptoms. And in fact, in most viruses, people get more and more infectious, contagious, as their symptoms get worse. So, you know, I worked a lot on Ebola, for example. We did not worry at all. There was not a concern for people spreading Ebola in an asymptomatic way. It just didn't happen. And once people started to get symptoms, it was as they were getting sicker and sicker. So when somebody died, that was actually when their body was the most infectious. One of the reasons COVID has been so successful as a virus is because it has this major ability to spread when people are asymptomatic. So broadly, flu and cold do not have a significant amount of spread in this pre and asymptomatic people in the same way that COVID does. I think, you know, this has made people go back and look in some more detail at some of the other viruses and understand some of that spread. But by and large, unfortunately, it's one of the things that makes it the most different. And it's why contact tracing has not been the panacea that it has for many other things. SARS, which again was our SARS and MERS both, were the previous two novel coronaviruses. And in both of those settings, we did not see spread among people who were not symptomatic. And so if you're doing a really good job of contact tracing anybody who's symptomatic, you can keep the control. It's this spread among people who are asymptomatic that really, unfortunately, makes the ability to control the disease with those traditional case investigation contact tracing methods not quite as effective. Genia Munoz on Facebook. What about free flu shots? Will CDPH be hosting free flu shot events? Yes and yes. So as a reminder, we are encouraging everyone over the age of 6 months, you should be getting your flu shot annually. It's more important than ever this year. We always see a surge in flu that tends to really put a strain on our healthcare system. With this second surge of COVID cases, we are going to really have the potential to get into trouble if we're seeing even a traditionally bad flu season on top of the COVID. So CDPH absolutely is hosting more than 50 free flu clinic events across the city. You can go to chi.gov/flu and see all kinds of places, the CDPH clinics, pharmacies, others, where you're able to get a free flu shot. But yes, CDPH has clinics going, including on the weekends. Okay. If I had COVID, do I have to get a negative COVID test to return to work? No, you do not. So just as a quick reminder on this, if you've been diagnosed with COVID, you've had a positive test, you need to isolate, meaning stay home, stay away from others as much as you can, as we said, even as much as you can within your own household, for 10 days. And that is 10 days from the beginning of your symptoms, or if you didn't have symptoms or you're not sure, from the date of test. 10 days and the last 3 days of the time period, you need to be better. Your fever needs to be gone. You need to be basically feeling back to normal. So you do not need a test at the end of that 10 days or 14 days or 17 days. All the data continues to suggest that it is really in this prescribed time period that people are shedding virus. And if you go and get a test, it's possible that the PCR test can continue to detect sort of dead COVID or COVID that doesn't have the potential to spread potentially for a long time. And so there's not a requirement on a repeat negative test, but you do need to keep that time frame. Good question. Renata Cerniak on Facebook is asking, are people who are being tested asked what county they live in? Are cases spiking in certain counties because that is where that person lives, or that's where they're testing at? All right, great question. So across the entire United States, for not just COVID, but every disease, the way we count diseases are by where the person lives. So when you get a COVID test, just like when you get any other test, any test that is a reportable disease, your doctor or your testing site reports your home address. So that's why when you go to the doctor's office, they ask you, what is your home address? Behind the scenes, the testing goes to the laboratory with your home address attached to it. And then we count all cases for all diseases based on the person's home address. So it does not matter where you were tested. If someone lives in DuPage County and gets tested in Chicago or in Cook County, they will get counted in DuPage County, because that's where they live, and vice versa. And so it is not that cases are spiking based on where the testing is happening. It is where people live. And we stick to that really strongly, because otherwise you could have this problem where people are getting counted in multiple places. So the medical examiner here, for example, has the full list of anybody who's dying in Cook County and where they live. The health department actually will get reports of people who may be living anywhere across the US right now, but if their official home address is in Chicago, their test results, or if they die, their death results actually are reported to the health department, because every test needs to only be reported once. So, good question. Okay, here's a question. What do we know about symptoms lasting long after COVID, especially for those who aren't too sick? Okay, yeah, I've been getting a lot of questions about this too. So, some people have heard about this long hauler idea. This is a term that's come into use. This sense that even when people are recovering from COVID, there are some folks who continue to have relatively long-standing symptoms. And we're still learning a lot about that population. I think I have a couple of I do. So here's a couple of studies for that too. There's one out of Nevada where they looked at 21,000 people in Nevada who had been diagnosed with COVID, and they followed them for about every 4 to 6 weeks between April and September. And what they found, the author is Cirulli, C-I-R-U-L-L-I. It's called Long-Term COVID-19 Symptoms in a Large Unselected Population. So these are folks who got followed up, and basically found that about 42% of the patients who had mild COVID-19 and a positive test for COVID reported actually having at least one symptom for 30 days or longer. And about 33% had a symptom for about 60 days, and about 24% had a symptom for about 90 days. And most likely, those symptoms were this loss of smell and taste, headache, or memory loss. So lots of studies like this going on. In this study, they found that the more symptoms somebody had at baseline, and if they were reporting having trouble with labored breathing or difficulty breathing, those were the things that were more predictive of long-term symptoms. There's another study here out of France that looked at similar follow-up and found that about 2/3 of non-critical COVID symptoms were still having some symptoms, and particularly that loss of smell and taste was persisting for some. So we're still learning about this very much, but I think increasingly there's a recognition that even where people are recovering, a lot of folks are having at least some continuation of physical symptoms, not to mention the mental health impact, particularly where people have had really serious illness. So learning more about that, there's a lot of studies if you're interested in following up. All right. Denise Sims on Facebook is wondering, is it safe for women to go and get mammograms? They take place in a more close setting. So this is where we want to make sure that there are not unintended consequences of COVID. I'm very worried about people putting off their routine health care, their cancer screenings. I hear about people not getting mammograms or colonoscopies, not taking their kids in for checkups to get their routine immunizations, et cetera. And I would definitely be recommending at this point, we've learned a lot about how to keep the risk down in our settings here in Chicago, in our public settings. And first and foremost, that's in the medical setting. So there's been a number of studies that have shown that the risk of getting infected in a medical setting is very low. Good mask compliance, as you can imagine, lots of attention to infection control in all kinds of ways. And so I would encourage people, recognizing that this is going on, that if you've been recommended by your doctor to get a follow-up test of some kind, that I would get it. You should obviously make sure that you're very careful to wear your mask, wash your hands, all of these things. I think our health facilities are doing a good job really good job of limiting COVID risk, but give a call in advance if you want to ask questions about the ways in which that they're taking it seriously. Okay. Doreen Barbieri from Facebook. How do I know if I have flu or COVID? You don't. You need a test is the bottom line. I've seen a lot of things trying to look at the differences. There's a few things where, people who have a loss of taste and smell, that seems to be much more likely related to COVID. People who tend to have, really feel like this total run over, got hit by a truck feeling tends to be more like flu. But let me tell you, no. The bottom line, unfortunately, is that you need to get a test to know the difference. We treat it and remember, what's our number one order from the very beginning? If you are feeling sick, you must stay home, except to get medical care or testing. And so I don't want you saying, I think this is the flu, I don't think it's COVID, I don't need to isolate. Home, and you need a test to know for sure. Don Bransford from Facebook is wondering, how many days after coming into contact should you be tested and how many tests? All right, good question. So again, this is a space that we continue to really be learning more in. And the bottom line is that, as you will recall, if you are infected by someone and you test right away after you've been infected, that test will be negative. We don't have to look any further than the White House outbreak to see that even very repeated testing does not protect you from COVID, because people can get tested and have a negative test, but be in that asymptomatic period, and it's the time where the COVID has not yet taken hold, and they can absolutely be spreading COVID. So broadly, if you've had a true exposure to COVID and you've been told that you need to quarantine, you need to quarantine for the 14 days, regardless of test result. Okay, let me just say that again. If you've been exposed to someone within that 6 feet for 15 minutes without the mask, a true exposure, you need to quarantine for 14 days. It can take up to 14 days for that test result to turn positive. Now, what we're recommending to people is that for most people, the test will turn positive somewhere in the 5 to 9 day range after exposure. And so if you've been exposed, and I know people are worried about this, and you want to get a test, please wait at least into that 5 to 9 day period. If you get a test at day 9 and it's negative, chances are pretty good that you've not been infected with COVID, but you need to complete that 14-day quarantine regardless. So I hope that is helpful, and I know it's hard. Every day, one of the questions we get the most at the health department is, if I get a negative test, can I stop quarantining? And unfortunately, the answer to that is no. Karen Ho on Facebook is asking, should we be holding off on elective procedures? So this is really a conversation for you and your doctor. Broadly, again, we've seen a lot of work to make our healthcare settings very safe, but I don't know what the elective procedure is. I don't know what your underlying conditions are. I would encourage you to be having a conversation with your doctor about that question. But what I don't want people doing, please, is if you're having something that is not elective, right? You're having chest pain, you're feeling like things are not well, you don't want to go to the emergency department because you're worried about COVID. No, like if you're having like something that you would normally seek medical care for, serious, you should be seeking medical care. Remember I said right at the beginning, we've also seen not just an increase in COVID deaths, but we've seen an increase in deaths related to heart disease, and some of that is for people delaying care. Kim Hale on Facebook says, I fall under the category of high risk, and I want to know, is it safe to go out with friends to a restaurant at this time, or is it better to wait? Kim, it is better to wait, particularly if you are in a high risk category. Right now, chances are high that there are people out in the world with COVID. With the amount of COVID we have right now, even getting 10 people together, randomly selected, there's about a 14% chance that one of them has COVID. At a restaurant, by definition, you're taking off your mask, you're probably not able to social distance, and if you're bringing sort of friends in, I would say, that's not your household. That's probably unnecessarily widening your circle. And please, especially if you're high risk, right now is the time for activities that are not really more essential to not be doing those. So thanks for the question. It's definitely better to wait. All right, we are coming up on time. I see a number of questions here. I'll ask you to tune in at 1 o'clock if you want to see some more about some of the statistics. And we do have some Robin McCarthy here is asking statistics on age of hospitalized cases, more details about hospitalization. If you go to the dashboard and specifically up at the top data, you can find out more about hospitalizations, but we are seeing increases in non-ICU hospitalizations and in ICU hospitalizations at this point. And that is just a reflection of there being, unfortunately, a lot more cases of COVID. Those do tend to lag, and so do the deaths. So I'm sorry to have a lot of bad news for you today, but that is where we are. Just to maybe finish on some good news, the vaccine trials are underway, and the 2 that had been paused are now back going again, which is a good thing. As a reminder, vaccine trials are paused when there's been a need to investigate. Is there the potential for a safety event related to the vaccine? Anything like this. It's very normal to pause a vaccine trial. It is how we know that by the time we're able to recommend a vaccine, the appropriate safety and efficacy work has been done, but those are underway. We're doing a ton of planning here, like so much planning for those vaccines when they are available. But we are a long way from a vaccine. Where I look at the numbers here and recognize that we need people now to double down on the things that have gotten us this far. I will maybe, in terms of the good news, I will point to just one more journal article here. This is from Zhang, Z-H-A-N-G, is the primary author in the International Journal of Infectious Diseases from October 8. It's the impact of mask wearing and shelter in place on COVID-19 outbreaks in the United States. And these modelers really looked, and they found that face mask wearing by 75% of the US population, even in absence of other control measures, meaning if only 3/4 of the people were wearing their masks, it reduces infections by 37%, hospitalizations by 44%, deaths by 47%. And when we combine face mask wearing and sort of more of a very, a shelter-in-place type thing, especially for those who are in the 50 to 64, we drop that risk by over 82%. And so the bottom line is that where people are wearing their masks, this helps us all. And it's one of the easiest things, truly, that you can do. We're working really hard at the health department to try to keep up with this surge in terms of case investigations and contact tracing. Your doctors are working really hard to handle the increased influx of people needing testing and care and hospitalization. We all know what needs to be done in terms of flattening this curve. So please don't have folks over to your home unless it's necessary. Wear that mask whenever you're going out. Wash your hands and be especially careful with anyone who is among your loved ones who's in that highest risk group. Remember, that's people over 60, and the risk keeps going up as people get older from there, and people with underlying health conditions. The other piece of good news is we are 1 week from the election. And I will let you know that here in Chicago, there's been a lot of work to put the necessary precautions in place to be able to have voting just as safely as we can from a COVID perspective. So I've already voted. I know a lot of you have, but please do put that ballot in the mail or drop it off. You can early vote at a lot of locations around Chicago. The social distancing, the cleaning is all very good. If you decide to vote on election day, know that there's been a lot of work to have those settings be as safe as you can. But I really encourage everyone to vote. And finally, we are in Halloween week, or what we called it here is Halloweek. So you can go to chicagohalloweek.org to read more about the guidelines, to download our Halloween toolkit for safety guidelines and signage. You'll see there's a lot of emphasis on how can we keep sort of Halloween a safe and relatively healthy holiday, particularly for our children. Outdoor trick-or-treating, in small groups, keep it moving. There's a lot of suggestions and advice around there. But let me underscore, this is not the year for adult Halloween parties. I do not want people gathering. I know it's hard. I love Halloween too. But this is not the year for getting together inside. I do want to celebrate Halloween and the costumes and the children and the mask wearing portion, frankly, that comes along with Halloween. But please, if you thought it was a good idea to host a Halloween party, please cancel those plans. We are doing so many outbreak investigations right now related to social gatherings, funerals and weddings and birthday parties and dinners. And unfortunately, it's when people let their guard down. And I don't want Halloween to be an excuse for a house party. So with that, thank you. We will be back on Thursday with opportunity to take even more questions. And we'll be out quite a bit this week, obviously, on the press conference side, sharing additional information. So double down, do the right thing, and be safe, Chicago. Thank you.